Well, the MAC members of Congress are winding down their summer recess, but it's been anything but restful. Many have held town hall meetings on health care reform. And soon, Congress will bring the opinions of their constituents back to Washington, including our next two guests. Congresswoman Debbie Wasserman Schultz of Florida is with me, along with Congressman Mike Pence of Indiana. Good to have you both with us. Thanks so much for joining us.
Thank you.
Be with you.
Congresswoman Wasserman Schultz, let me begin with you. You've held town hall meetings on reform. What are you hearing?
Well, we're hearing, a lot of different types of concerns, but mostly people talk about how difficult it is for them to continue to either provide health care to their employees if they're a small business owner, or people who are dealing with 15 to 20 to even 30% increases every year on their health insurance costs. And they want us to get a handle on it. They know health care reform needs to happen, and they want answers to questions about the details. And I've been, like many Democratic members across the country, have been talking to my constituents about the fact that our health care reform plan will end the insurance industry's ability to drop them if they have a pre-existing condition, make insurance portable, make sure that we can end lifetime and annual caps, and generally bring down the health care coverage. And so people are really responding to that message. It's been a good August. I had a great town hall meeting on the telephone last night with 4,000 participants. So it's time consuming. We're trying to get the message out. It's a very big issue that people have a lot of angst over, and it's going to take us some time to get the information out to them.
Representative Mike Pence, what are you hearing from yours?
Well, I appreciate Debbie's candor in beginning by saying that she's heard a lot of concerns. In the 4 town hall meetings I've had in Indiana and the 3 I'm about to have this week, we've heard a lot of concerns about the approach that's being advanced by Democrats in the House of Representatives. But there's no question that people know we need to do something to lower the cost of health insurance to working families and small businesses, and we need to do something to lower the cost of health care. But the Americans I've been talking to in Indiana and a little around the country don't want to set us on a pathway toward a government takeover of health care, and I think they understand that if you pass legislation that offers a public option in health insurance to every American, that millions of Americans will lose the health insurance they have as the employers cancel that coverage and send them to the public plan. And they know that that's not going to have the intended effect of lowering the cost of health care, lowering the cost of health insurance. But there are reforms. Republicans are ready to come back to Washington, D.C. and work with people like my friend Debbie and pass to really deal with the issues the American people are concerned about.
Certainly one thing that, Debbie, you said earlier, and I think that has been very widespread at this point as far as a concern on the part of people, is detail. People really want to understand how it is, in fact, going to impact them. So let me throw out a question to you both. Congresswoman Wasserman Schultz, I'd like you to take it first and explain to our viewers how we are going to see an increased number of people under the umbrella. You're talking about possibly 47 million Americans that need coverage, that we need to get insurance coverage for their health care under the umbrella, and do it in a way that is going to be less money, and do it with probably the same amount of doctors, if not fewer doctors. How do you have fewer doctors or the same amount of doctors covering more people at a lower price? Can you detail how that's possible?
Well, I can give you some outline of how that's possible, because let's focus on not the 47 million people that don't have health insurance. Let's focus on the millions and the majority that do have health insurance coverage, and the fact that if we don't do something soon, many of those millions are going to lose the coverage that they have now. And, I love my friend Mike Pence, and we are good friends, as we always talk about when we do these shows together. But, I mean, he knows better than that. There's certainly nothing could be further from the truth about a public option causing people to lose their health insurance because their employers will drop them. This plan that we are moving forward with will give people more choice. If you like your coverage now, you'll be able to keep your coverage. If your employer chooses to instead of providing health insurance coverage to their employees, put people into the exchange and allow them to make their own decision about the type of health care that they want, they'll be able to do that. But the public option will compete side by side on an even playing field with the private health insurance market and force them to be more innovative, Maria. They'll have to compete and be honest with their consumers so that they can prevent their losing customers into the public option. They're going to have to make more of an effort to attract customers than they currently do, because right now the entire health insurance system is totally profit-driven. We need to make sure that it is patient-driven and focus on making sure that there are good consumer protections in our health insurance coverage so that people don't get the short end of the stick and have to continue to fight insurance company bureaucrats to get the coverage they think they have, instead of allowing their doctors to make the decision that's best for them with them in consultation.
But I still don't understand how you're going to cover the people at a lower price with the same amount of doctors. See, that's what's missing in this, and it's on.
Well, here,
we've heard both sides of this. We've heard the politics.
Well, I want to
of
be
it.
respectful of. I'm happy to add on to my answer. I just wanted to be respectful and give Mike some time too. But I'll add to what I just said by going further and saying that if you put everyone in America into the overall coverage pool, by its very nature, the sheer volume is going to bring down the cost of coverage. I mean, right now, we obviously have 47 million people that don't have...
If it's more people, how does it bring down the price?
Because the way insurance works, if you have more people and more healthy people added into the mix, you are broadening the pool and bringing down the premiums and bringing down the overall cost. The smaller the group of covered individuals, the higher percentage you have of sick people who drive up the cost of that care. And when you don't have everyone in America covered, and 47 million people are needing to use the emergency room as their primary access point for health care, then that's the most expensive way to access the health care system. So you're going to bring down the cost of coverage as a result of those individuals being added into the system as well. So there are a variety of other ways we're going to be able to achieve savings by really tightening our belts and making sure that we can squeeze savings out of Medicare and out of Medicaid, because there's some efficiencies that really need to be addressed and that we're going to address in the health care reform plan. So there are a variety of different ways, but those are the will be the cost of care. You know, it might seem counterintuitive that you add more people and as a result, how could it be less? But that's essentially how we're going to do it.
Congressman Pence?
Well, let me just say, I think that the whole issue of people losing their health insurance if a public option comes into high relief when you recognize that, and I don't have to tell CNBC viewers this economy is struggling. I was in Evansville, Indiana just last Friday when they announced that the Whirlpool factory that had been there for more than a half a century was closing and moving out of the country. You know, with all due respect to Debbie and my other colleagues, you know, as soon as Uncle Sam offers a public option for health insurance that businesses would be able to send their employees to, there's not an employer in this country struggling in this economy who isn't going to take an awful hard look at sitting their employees down and saying, look, we love you, we love having you work here, but we can't any longer offer you health insurance. We're going to pay the minimum fee under this law, and we're going to send you to the public plan. That's how people are going to lose the health insurance that they have.
Maria, let me just interject. Let me just interject because, Mike, you're not describing how it would work accurately. If an employer decided, instead of providing coverage to their employees, instead they decided to pay the 8% payroll tax and put their employees into the exchange, those employees would be able to choose either a private insurance plan in the exchange, any one of the dozens and dozens of private insurance plans that are available in America now, and we expect that more would be available in the exchange, or they could choose a public option. But don't suggest to people that if their employer decides to go in that direction, that the only option is the public option. You know that's not true.
Yeah, but does the private option get smaller and smaller? Does the private option get smaller and smaller if, in fact, the public option becomes sort of the norm?
That's right. That's
right. Because
you're going to have an organic reaction as people go into the public system. You're going to have people go to that system that taxpayers our underwriting, and you're going to see insurance companies move away from offering private. You know, the answer really here, Maria, is to let.
Why would the private industry? Why would the private?
Let me have a word.
Why would the private insurance industry just collapse?
What we ought to say,
They're going to get more innovative.
what we ought to offer the American people is the same health insurance coverage that Debbie Wasserman Schultz and Mike Pence are allowed to have under the Federal Employee Health Benefits Plan, which doesn't include a public option. We ought to allow every American to purchase health insurance.
How come you guys have such great health care benefits? And I mean, would you go? What would Congress be ready to say? You know what? We want to change our health care benefits, and we will take the public plan. Would you be ready to do that?
Sure, I would. Sure, I would. I mean, but because we.
Will you do it? So will you do it?
I just said, sure, I would. Which part of yes did you not understand?
Mike Pence, you will do it.
No, I to be honest with you, I don't think any American, including Debbie, should be relegated to a public option plan with, with the rationing and the limited resources that are going to.
Oh, come on, we have rationing now. It's called rationing by an insurance company.
Yeah.
Insurance company bureaucrats ration every day.
Yeah, but
you know and I know
that
in our
offices, I can go get a different insurance plan.
Are you kidding me? There's no insurance company in America that doesn't ration. We have to make sure that the decisions are between doctors and patients.
Healthy debate, and we hope you'll come back as obviously this story continues to develop. Thank you very much, Representative Debbie Wasserman Schultz, Representative Mike Pence. We appreciate your time tonight.